We went to Guatemala, specifically Antigua, Guatemala. We have been successfully coordinated in the past cultural and also service learning activities for our students.
Honestly, I'm kind of just hoping to take in the cultural aspects. It's such a different atmosphere than we have in America, and I think the way that different cultures celebrate just their generation, their religional kind of experiences is such a thing to take in, to learn, and to value, as well as like the different aspects of healthcare, how they perform their healthcare systems versus like other countries in the United States and even in Europe.
You know, it incorporated just every aspect of healthcare for these individuals. So based on the experience that they're having in school here at East Stroudsburg and how it lined up with their degrees that they're currently pursuing, we tried to make sure that they were exposed to the experience that would better complement what they were learning.
I learned so much. I was one of the few students who got the opportunity to go into the OR. So I watched a hernia be removed laparoscopically. I also got to see how the equipment were sterilized. That was a very, very, very unique process.
In there, although the resources were very limited, we could see how the workforce there made the best they could with the limited resources. And in addition to that, the patients were very grateful with the little bit that they could receive.
I'm a public health major, so the way it's affecting my career was completely different from those going into pre-PA or nursing, and just seeing what path everyone was going to take this experience and what they were going to do with it individually. You just get to know people on a deeper level, and like it made me excited to get to know that this one experience of us all volunteering gets impactful ways in like so many different people and so many different branches of their careers and what it's going to do.
I am always looking out for the good of others, and so I love advocating. That's why I really love public health. And I realized that, okay, how can I do this and also care for my patients in another way and go back to nursing? And going to Guatemala has sealed the deal for me in that sense. And I decided that going back to nursing and pairing it with my administration would be a great thing for me to become a floor manager, something at the hospital where I can advocate for my patient and care for them in a medical way at the same time. And Guatemala did that for me.
In the afternoon, they did have the learning cultural aspect of the program. We were able to look at history in terms of the Mayan culture. We visited the Simche historical ground. We also visited the Cerro de la Cruz. We visited the many shops and many places in the city of Antigua. In addition to that, the students were able to see how coffee, which is one of the main crops that it is exported out of Guatemala, is produced, is processed, and they were able to taste the coffee. The other product is cacao, in which they were able to go to a cacao factory.
Just being able to experience something that's like outside of ESU and outside of a classroom, I think you get such more of an appreciation for it because it's not a class at that point, like your day to day, it's an experience. But it was also mixed with a full week of just cultural experiences. So learning about their history, learning about the people there. We ended up being there at the same time that their Lent procession started. So that was an amazing experience to see. They did this kind of ritual where they make little like carpets out of wood shavings throughout the streets of Guatemala. You hiked a bunch up volcanoes. It's so different kind of just seeing the different parts of Guatemala that we kind of got to ride through and seeing what everyone does for work and how they support themselves and learning about their backgrounds.
Culturally speaking, the better professionals we are and the better professionals we are graduating from our university. I believe that we should continue to do this type of program, and we should expand these type of programs. We let them discover that they have more skills than what they thought they have. And not only that, that what they have could impact other people's life.